Good afternoon and welcome. Thank you for joining us for today's training, a facility assessment approach to behavioral health, hosted by the Center of Excellence for Behavioral Health in Nursing Facilities. I am Nikki Harris, Training and Education Lead for the Center of Excellence, and it is my pleasure to oversee the delivery of mental health and substance use disorder training and education to nursing facilities nationally at no cost to the nursing facility. And now, I am happy to introduce our presenter for today, Mr. Jacob Berlowitz. Jacob serves as the Program Manager for the Center of Excellence for Behavioral Health in Nursing Facilities. Jacob has 15 years of clinical and administrative leadership experience as a nursing home administrator, director of social work, and a licensed social worker. He has served at nursing homes ranging in size from 700 plus beds to 50 beds and has designed and implemented specialized nursing home units and programs to serve the behavioral health needs of residents. And now I'll turn it over to Jacob to begin the presentation. Thank you.
Thank you, Nikki, and good afternoon, everyone. Thanks so much for joining us today. Our goal today is to give you some very practical information that you can take into your facility and implement right away. Hopefully, we'll give you some tools today that will be helpful for you. Encourage you to chat any questions you have during the session. If you'd like to share where you're joining us from, facility name or the city and state that you're joining from, that might be interesting for all of us to see where all of the different attendees of today's session are from, and so that we can kind of feel like we're together in one room as we're learning together. And before we jump into talking about facility assessment for behavioral health, some of you may be aware that CMS released a proposed rule on minimum staffing mandate last week. Probably everyone on the call is aware. And you may have noticed that a component of that proposed rule talked about facility assessment, enhancing the facility assessment. And in that area of the proposed rule, CMS mentions clarifying that facilities must use evidence-based methods when care planning for residents, including consideration for those residents with behavioral health needs. They mentioned this under facility assessment. And so I wanted to clarify for everyone that all of the material in today's presentation was developed before CMS announced that proposed rule. And of course, as a proposed rule, we don't know what the end rule will look like and whether it'll have any significant implications for how we do a needs assessment or a facility assessment as it relates to behavioral health. But either way, this information in today's session is all about proactively looking at your facility and thinking about the behavioral health needs of the residents, thinking about your facility's capacity to meet the needs of those residents, and what steps you could take today if you wanted to work on that and kind of take your facility to the next level of behavioral health quality care. And so with that, let's dive right in. Let's talk about why to conduct a behavioral health needs assessment. Some of you may be familiar with a needs assessment or a gap analysis, where you take a look at what you currently have and what you need, and then you identify what those gaps are and how to work from there. And that's a lot of what we're doing in a behavioral health needs assessment. It's a systematic way of evaluating all of the current behavioral health needs in the facility, and it gives you a roadmap for what to do next, what actions make sense for you to take in the facility to improve the behavioral health care and to make sure that you're meeting the needs of the residents. And notice what we all have on the slide: meet the requirement for behavioral health component to the facility assessment. So even without any changes that may come out of this enhanced facility assessment, there's already a lot of guidance from CMS around facility assessment and behavioral health. So I encourage you, if you haven't looked at the section in the State Operations Manual, right, that's CMS's guide to the surveyors, the section that talks about behavioral health, which is mostly from FTAG 740 to 745, that's kind of the main area where there's a lot of discussion about behavioral health. And if you look there, you'll see that there's constant mention of facility assessment and the requirement for facilities to evaluate the acuity of the population, including residents with mental disorders, substance use disorders, history of trauma, PTSD. So this is something that's already a required component of a facility assessment. And some of you may be familiar with one of the common tools that's out there. There's a spreadsheet that's distributed widely. I know I used it when I was an administrator to complete a facility assessment, and it has a lot of different tabs to cover all the different areas that we cover on facility assessment. And in one area, it does talk about behavioral health care needs, which is great. It's based on the CMS Form 672, which any administrators, directors of nursing on the call, I'm sure you're familiar with the CMS Form 672 resident census and condition of residence that is always asked for at the beginning of a survey. And in there, if you look at field F112, it says behavioral health care needs. But if you look at the instructions for how to fill out field F112, the instructions are all about referring to MDS Section E, which is all about behaviors of residents. So that does capture some information, but we'll talk about today some other ways that you can get much more rich information about the behavioral health needs of your residents and how to make sure that you're meeting their needs. And so with that, let's go over our process. We have 4 steps. And again, for those of you who may be familiar with the gap analysis, you'll kind of see some similarity here. Our first step is we're going to identify all of our facilities' characteristics and needs. What does our current resident population look like? What kind of needs do the residents have? Or what are the current needs within our community of all of the prospective residents, right? So all of those referrals that we're getting, what are we seeing in the referrals that we're getting from hospitals? Then in step 2, we're going to look at facility capacity. That means what kind of things do we currently have in place in our facility to support residents who have behavioral health needs. And we'll look at that from many different aspects. And hopefully as we're doing that, not only will you have a roadmap for how to evaluate your facility, but it'll also maybe give you some ideas for other things that you can do to support residents in your facility related to behavioral health, as it may be appropriate for you, right? There's no one size fits all. And so some of the items that we go over may make a lot of sense for your facility. Some of them you may say, no, that's not really relevant for us. And I encourage you to just tailor it to what works for you. Don't just think about this as a rigid process. These are just suggestions of items that you can look at. And so in step 3, we're going to take a look back at steps 1 and 2. We're going to take a look at our identified needs. What do our residents need? Versus what's our facility capacity? What are we able to do? And then we're going to identify any gaps, and that'll tell us where we can focus our efforts, where we have an opportunity to improve our quality of care. And then number 4, I like to call the hardest part of the work. Right up until now, we've just been gathering data and evaluating. In step 4, we're going to actually develop and implement a plan. We're going to make some changes. We're going to take a look at how we can actually implement a change to bridge that gap that we've identified. And we're not going to go over steps 3 and 4 today. We're going to dig into steps 1 and 2. How do you gather all of that information about your facility? And what are some good data points that you could look at gathering so that you kind of have a profile of what's going on in your facility? Steps 3 and 4, those are something that we'll talk a little more about towards the end of the session, kind of how to take those next steps. All right, so let's start talking about step 1, our facility behavioral health characteristics. We're going to look at a few different areas. We're going to jump into each of these in a little bit of detail. So we'll start with residents who have a diagnosis of mental illness. We'll talk about medications, antipsychotics, psychotropics, substance use disorders and history of substance use disorders, residents with a trauma history, residents with a PASSAR level 2, pre-admission screening, and then incidents. And so let's jump right into the first one, mental illness diagnosis. And for this, we're going to look at serious mental illnesses. So schizophrenia, bipolar disorder, major depressive disorder. And we're going to gather a number of how many residents in the facility have a diagnosis, currently have a diagnosis of one of these disorders. And so how can you find this information? And for each of our items that we go over, I'll try to give you some tips for how to gather that information. So depending on the capacity of your electronic medical records, what the ability is through them, you may be able to do a diagnosis search. Like I used to do that when I was a director of social work. I would pull a diagnosis search within the EMR and kind of look at how many residents had schizophrenia. And usually I had to be mindful of what the most common terminology was used in my facility. Because keep in mind, with all the new ICD codes, there might be schizophrenia, schizophreniform, and then a whole host of other ones, and so on and so forth for each of the diagnoses. So take a look at what's most commonly used, try to capture all of those in a search, and then do a search and document the number that you come up with. How many residents have schizophrenia? How many have bipolar disorder? How many have major depression? Another way that you can look for it is in the MDS. In the I section of the MDS includes a lot of diagnoses. And so in that section, if you look specifically at I 5700 through I 6100, you'll find that those are all psychiatric illnesses. So you'll see a lot of these same behavioral health diagnoses. And so if you're able to do a search of the MDS, or maybe your MDS coordinator might have the most experience with how to do that, how to pull that data out of the MDS. If you search those items, you'll be able to, again, find a similar list. And it might be interesting to do a cross comparison, right? To make sure that your medical record is matching up to what you're documenting and reporting in the MDS while you're doing that. And so I encourage you to remember, I'm going to say this one time on this slide, but it applies to all of the data that we'll be reviewing. The data is only as good as the person who entered it. So we really want to think about who's putting in those diagnoses, for example, into the medical record. Is that someone in admissions? Is it the nurse? Is it the MDS coordinator? Maybe somebody different in every facility, right? And so how accurate is it? How comfortable are we with that information? And similarly in the MDS, who's putting in that information, and do you have confidence that that person is properly capturing those diagnoses? Since we're talking about mental illness diagnoses and we're mentioning schizophrenia, always have to mention, we know that it's been found that schizophrenia has been misdiagnosed at times, or it's been documented in the MDS when someone maybe didn't truly have schizophrenia. They may have had some other disorder. They may have been on antipsychotic medication, and there may be some corrections that are needed. So you always want to make sure that those diagnoses are accurate and that they're following the APA, the American Psychiatric Association's diagnostic criteria. You can learn more about that in a different session. We're not going to spend a lot of time on that, but just wanted to mention, as you're looking at that list of diagnoses, if you see on that list of residents someone who's diagnosed with schizophrenia and you say to yourself, no, that doesn't sound right, pay extra attention to that and make sure that you're addressing that. We know that schizophrenia audits are happening nationwide now. We're hearing about them in the center from some facilities as they're working through the outcomes of those audits. So encourage you to be mindful of that and be proactive with looking at that. All right, so we've finished our first data point. We've looked at mental illness diagnosis, and we've captured how many residents have that diagnosis. Be mindful that you want to think about how many, what's your total number, and then what is that as a percentage of the residents in your facility. For example, having 5 residents with a serious mental illness in a 50-bed facility would be very different than in a 300-bed facility, right? It would mean that you have a different proportion of residents with a serious mental illness, and you might approach it a little bit differently. All right, our second item is medications. I know that there have been lots of programs and lots of quality improvement efforts focused on antipsychotic medications. And so it's very likely that many of you are familiar with how to gather information about antipsychotics, and you may be familiar with what the different antipsychotic medications are. But let's talk briefly about that. You can pull it from your electronic medical records, You might be able to do an order search where you search for anyone with an order for XYZ medication, and you can put together a short list of medications and check that. Or your consultant pharmacist or your pharmacy may already be giving you a report on antipsychotics. I know, as an administrator, I would get those reports on a monthly basis and take a look at them and be able to, kind of really have a picture of the antipsychotic usage. But I would encourage you to also ask for psychotropic medication usage. So that means other medications that are for mental illness. So for example, antidepressants, anti-anxiety medications, because those will also tell you about residents who have behavioral health needs, right? Even if they don't need an antipsychotic, if they need medication for anxiety or they need medication for depression, they also may have unique needs that you want to make sure that your staff are prepared for outside of just medication. All right. Next, we have substance use disorders and history of substance use disorders. And so I always mention and history of, because the history is very relevant. When someone has a history of substance use disorder, they may not have a current diagnosis, right? The hospital may have not had a diagnosis for them of substance use disorder, and your staff may not diagnose it because it's not an active medical diagnosis for them. They only have a history. They're in recovery at this point, but they still may have some very special needs that you need to be mindful of. So important to capture both residents with a history and residents who may have a current diagnosis, which may mean they were actively using right before they were admitted either to the hospital or to your facility. And so again, we would start with a diagnosis search in the electronic medical records, but you can tell us, what your experience is, and I'd love to hear about it. Feel free to send me a message or share in the chat here also if you're comfortable doing that. But very often we find that these diagnoses are not captured so well in the medical record. So you may also look in a social service assessment, and I encourage you to think about, as you're working through finding substance use disorders in history, if you're having trouble finding this information and kind of tallying it up for your residents, think about how the other staff may or may not have visibility into which residents have special needs related to substance use disorders, right? If, say, you're a medical, you're a nurse manager, or you're an administrator, director of nursing, and you're struggling to identify those residents, how can you expect the floor nurse or the CNA to be mindful of that and to know how to work with those residents, right? So think about that, whether you currently have a good system for clearly identifying those residents, or whether that's something to work on that you'd like to improve. And so I'm curious, let's take a snap poll if you're comfortable participating. Who's capturing substance use disorder in your facility? If you don't mind just chatting in, is it your, maybe admissions, social work, a nurse, MDS, somebody else that I'm not mentioning? Who is it at your facility that's capturing this information? And I'll note for you, it's not, there's no assessment within the MDS for substance use disorders, although there is an expectation that facilities are assessing and are knowing whether residents have a substance use disorder. So I can't see the comments as you're chiming in because I'm sharing the presentation, but I'll be looking at them later, and I'm sure all of you are looking at each other's processes and maybe sharing and learning from each other. So thank you for chiming in. All right, so our next topic is trauma history, and kind of similar to substance use disorders, this is something that's really come to the forefront for us, right? We're all mindful of the requirements for trauma training and ensuring that we're addressing the needs of residents with a trauma history, but there's no clear way to capture it in the MDS. Sure, if someone has a diagnosis of PTSD, post-traumatic stress disorder, you will maybe see that in the electronic medical record. You might then transfer it over to that I section we were discussing in the MDS. But very often, someone may not have a diagnosis of PTSD, but they have a trauma history, and it's affecting them, and it needs to be care planned, and they do need some special care around it. So again, just trying to think about, where is this information currently captured in your facility? maybe you've just started at a new facility. I know I started at a new facility, and one of the questions I had was, okay, so how are we doing this team? Where do I find this information? So if you might be new at a facility, ask the team or take a look into it. Where is this information? Where can I find this on each resident? And again, if it's challenging to find that information, think about how are the rest of the staff accessing that information to make sure that they're providing good care to the residents. And so let's take a poll on this one too, right? Let's learn from each other. Where are you capturing trauma information, a trauma history in your facility? Is it a social work assessment? Is it maybe a separate assessment that's being completed by, I don't know, maybe nursing or activities or somebody else? Let us know. Let all of us know, right? Where are you sharing that information, and how do you find it in your facility? Let's learn some good ideas for that. All right, and our next item remember, just to kind of recall, we're going through facility characteristics here, right? We're trying to identify all of our residents and what their needs are, our current residents that are in the facility. So our next item is the pre-admission screening and review. Most of us call it PASAR. And so looking at the number of residents that have a level 2 PASAR. Now, level 2 PASAR can be for either mental illness, serious mental illness, or it can be for developmental disabilities, all right, like something like Down syndrome or another developmental disability. We're not really going to focus on developmental disabilities today, right? That's not what we're focusing our energy. But we're going to look at those serious mental illnesses. And so first of all, what are our total number of residents with a level 2 PASAR? And how many of them may have specialized services recommended? If you're not familiar with that, I encourage you to look into PASAR a little more. There are some scenarios where on the PASAR level 2 determination, there are specialized services that are recommended by the person making the determination, right? Whatever agency is doing that in your state may make recommendations. And it's very important that you follow those recommendations, both for the benefit of the resident and also to make sure you're in compliance. And so where can you find this information? This is another tricky one. You can check MDS item A1500. Now, A1500, the A section of the MDS is all about just kind of basic demographic information about the resident, right? Like their admission date, where they came from, their social security number, their date of birth, but it also asks about PASAR. And so if you look at A1500, you'll see that that's a yes or no question where you're indicating whether the resident has a level 2 PASAR determination. And so if you're able to pull a search of that, or maybe your MDS coordinator can pull a search of that, you'll have a quick snapshot of residents that you're currently reporting as having a level 2 PASAR determination. Now, you may have some other places where you can find this information. The PASAR process, even though it's a federal requirement, it's actually managed at the state level. And so every state has a different setup for how all the PASAR information is held. So I can't tell you what your state is doing, but you may have a PASAR database, an online database. A lot of those exist nowadays. Many states have them, where someone on your team hopefully has a login to that database and is able to view all the residents in your facility that are currently logged as a level 1 and as a level 2. Or you may have a binder or a file where you keep all of those PASAR determinations. I know, when I started in long-term care, everything was on paper back then, and we were faxing back and forth with the PASAR agency. And so we kept a big paper binder. And in some facilities, you may find that in your facility, you still have a paper binder. So where is that information currently? And as you're going through this, also consider, as you see that list, which maybe you're seeing kind of with a fresh set of eyes, right? You're pulling out this list of all the residents who meet that level 2 requirements. And you take a look at the list and you say, hey, such and such resident, I'm pretty sure that resident meets the criteria, has a serious mental illness. Why are they not on this list of residents that I just pulled? So you might have an opportunity here to identify someone who you think actually should have been captured here and wasn't captured. And sometimes that happens because a resident may be admitted on a 30-day waiver. A lot of states have a waiver component for level 2 if someone's being admitted for short-term care, and then it turns out the person actually ends up needing care for a longer period of time and somehow falls through the cracks. So you may have an opportunity to catch that and to submit at that time for the level 2 review. And I can tell you, I've done that before, as a director of social work, taking a look and kind of comparing and saying, wait, I think we've missed a couple of these residents, and catching it and submitting it, and catching that information in advance. So I'm curious, let's try one more time. Appreciate everyone engaging with the poll, and hopefully it's interesting for you all. Who's tracking the PASARs at your facility? Who's the right person to get this information from? Is it admissions? Is it social work? Is it somebody else? Are you keeping a binder of some sort, or are you using a database? How do you find this information in your facility? What are you currently doing? Let's learn from each other on some good practices for capturing the PASAR information. All right, and now we're up to our last item in step 1. Our last item is incidents related to behavioral health. Now, before we get into this item, I'll say this one is the most subjective, right? It's a data point, but it's really, you've got to use your own judgment in determining whether an accident or incident was related to the behavioral health needs of a resident. But there are some examples that could be pretty straightforward, like, for example, a resident who goes out on pass and comes back heavily intoxicated and then has a fall and breaks their hip, right? So now you have an accident with a major injury, and it was pretty directly related to their substance disorder, where they have a problem with drinking too much alcohol, right? To the point where they've actually had a fall and hurt themselves very badly. That would be kind of a pretty straightforward example. It could get more confusing and more complicated when, I don't know, maybe you have a resident to resident incident or a resident to staff incident where someone becomes aggressive, maybe hits somebody, and you may feel that it's related to their behavioral health needs, and what could have been done, and you're taking a look back at it and saying, how can we better manage the needs of this resident to prevent this kind of incident? And not that it's always preventable, right? But just understanding how often is this happening related to behavioral health. I worked with a facility one time where that was one of their goals. They had a lot of residents with behavioral health needs, and one of their goals was to reduce the number of incidents related to behavioral health needs of residents. They had a lot of incidents, and they started implementing a program consisting of staff education and other components of kind of restructuring to meet the behavioral health needs of the residents. And one of the metrics they were looking at on a monthly basis was, month over month, how are we doing on incidents and on psychiatric hospitalizations? Are those numbers going down? If they're trending down, that's a sign that hopefully the work that we're doing is having an impact. And so where can you find this information? You can review your incident log, kind of take a look through the incidents and determine which ones you feel may have been related to behavioral health needs. I say take a look at the last 6 months, but maybe you're blessed and you've had very few incidents in the past 6 months. So then look back at 12 months, choose a proper amount that will give you a good sample so that you can get an idea of your needs. And you can also look at the ATD data, right, in the electronic medical record to see any hospitalizations related to any psychiatric hospitalizations that would tell you it was behavioral health related. All right, so we've finished going through step 1. This is not a be-all end-all, right, like we mentioned, but this should help you kind of map out some information about the residents in your facility and their behavioral health needs. And so let's jump right into step 2. We're gonna take a look at our capacity to meet the needs of those residents, all of those needs that we just identified. And you may have identified that your facility has lots of residents with substance use disorders and needs related to that, but not a lot with serious mental illnesses. Or maybe another facility identified the exact opposite of that. And that'll impact what kinds of services you're looking for and what kind of capacity you want to make sure is in place in your facility. So here are the items that we're going to look at, and we'll talk about each of them in detail, just like we did in step 1. We'll look at staff training, psychiatry, medication management, psychotherapy, other specialized behavioral health staff. If you don't know what I mean, we'll talk about it a little bit more. Specialized care areas, right? Defined areas in the facility where that care is being provided, and community agency partnerships around behavioral health. Let's start with staff training on behavioral health. What trainings are you currently offering in the facility that give the staff skills and knowledge around mental illnesses, substance use disorders? I recommend looking back at what trainings were actually completed by staff, let's say in the past 12 months or the past 6 months, what trainings were offered and completed, so that you can really have an understanding of what do the staff currently know about how to work with residents with behavioral health needs. Because you want to have an understanding, what's our current capacity? What do our staff actually know as far as how to work with these residents? Suggest looking at any person-centered care training that you're currently doing. I know that's a big focus area, and you may be already offering trainings around that. And person-centered care very much relates to the proper approach for how to work with someone with a serious mental illness or a substance use disorder, right? Looking at things from their perspective, not just telling them what to do, but thinking about what's going on for them and how can you arrange the day around their needs. So it's very related, and if I were in a facility today, that's what I would be looking at. Have we given our staff those skills as a starting point? And then I would, of course, want to have some more knowledge around the specific kinds of residents that we have. Say we have residents with substance use disorders. What kind of knowledge do the staff have around substance use disorders, around warning signs and symptoms of an overdose, how to respond to an overdose, right? Whatever is relevant for the kinds of residents that we have in the facility. And so where you're going to find this information, you might have used software, or you might use paper, right? Depending on which facility you're in. And you may have somebody who's responsible for all of those staff and services who you can ask to gather that information together. Psychiatry and medication management. So who do you currently have in place to do that? Do you have a psychiatrist? In some facilities, it's now a psychiatric nurse practitioner who's evaluating the residents and making those recommendations about psychotropic medications. And so I would consider, how often is that person coming to the facility? Is it once a month, once every 2 weeks, once a week? I don't think I've seen more often than that, but consider what the needs are in your facility, and then how often do you have someone coming in? And when they come in and make recommendations, do you have a good process in place to make sure that those recommendations are going through the attending physician or through the interdisciplinary team and being reviewed and implemented? And so ways that you can check this: you can check the medical record for documentation of these reviews taking place. And the service, the psychiatric service, might be managed by a few different people, right? It's different in every facility. It might be the medical director who's overseeing that, might be the director of nursing, director of social work, who's kind of liaising and managing that relationship with the psychiatrist, and might be able to give you the best information on how often they're coming and what process is being followed with their recommendations that they're making. Psychotherapy. So this is separate from medication management, right? This is talk therapy, psychotherapy services. And this is another important component of good behavioral health care. So taking a look at what kind of provider do you have coming in? How often are they coming into the facility? So again, right, how often do we need them to come in? How many residents need psychotherapy? If you have a large amount of residents, then maybe they can't all be seen in one day in rounds, but rather the psychotherapist needs to come back twice. Therefore, they're coming every week, or they're coming twice a week, depending on the amount of need that you have or the size of your facility. Is every language covered? I worked at a facility where we had a large population of residents who spoke Spanish only, and many of them needed psychotherapy, and we really struggled to find a psychotherapist who spoke Spanish, because having a translator for psychotherapy is, it's just not an ideal situation. And so we were able to get one sometimes, and then we would lose them, and then we were trying to get it back, right? So identifying that, do we have a challenge there? Do we have some residents who are struggling to meet their psychotherapy needs? And also, if you're in maybe a rural area, you might have trouble finding in-person psychotherapy services altogether. And so you might be offering telehealth. I know a lot of folks are doing that during the pandemic, but that's continued for a lot of facilities that maybe have trouble finding in-person psychotherapy. And it's acceptable to use telehealth psychotherapy, but I'm sure that most people would agree it's probably not the same as that in-person feel for talk therapy. And so identifying that, right? If there is something you can do about it, you can look into it. If there isn't, still kind of being aware of what's our capacity. Well, we're kind of limited. We can only do telehealth psychotherapy right now. We don't have any other options, excuse me. Okay, let's talk about other behavioral health specialists. So here are some examples of some other specialized staff that your facility may or may not have: a psychiatric nurse practitioner, a psychiatric nurse, meaning an RN level, but with psychiatric training, a behavioral specialist, whatever that may mean in your facility. They might have a variety of different backgrounds, behavioral health backgrounds, an activity specialist that has a behavioral health specialization, or a behavioral tech. That's like the equivalent of a nurse assistant that's used more in like an acute inpatient psychiatric setting, a hospital psychiatric setting. They have behavioral techs. And so think about whether any of these, or maybe something else, is something that you currently have in your facility, or something that would be beneficial. Now, typically, the time when one of these other specialists would be appropriate is if you have a larger population that have behavioral health needs, right? It's not just one or two residents. Maybe you have a group of residents that have a particular type of need, and therefore you're able to support their needs by adding one of these team members. And keep in mind that we're not just talking about justifying an entire position, right? A full additional 40-hour-a-week position of one of these specialists. It might be a part-time position. It might be a consultant that just comes in once a week for some rounds together with the interdisciplinary team. So it could take on a lot of different models for how to implement this. And so think about whether you currently have something like this in your facility, or whether any of these particular positions or something else might make sense for your facility. For example, if you have 30 residents who have serious mental illness, that's what you've identified in step one, you might have a benefit from having one of these people on your team to help support your staff. Even if you're giving education to the staff, maybe having someone who's a specialist, even if they're not a full-time team member, if they're coming in once a week and giving some guidance to the team and evaluating those residents, helping give input into their care plans, that might be a real benefit for you. That might be something that you're able to do, right? That's not requiring you to add a full position. Specialized care areas. So that's a model of cohorting residents who have specific needs. And sometimes that's done for behavioral health. Now, this doesn't need to mean that it's a restricted access or a locked unit. It could just mean cohorting residents together and then providing a different staffing model for that area, a different physical layout for that area of the facility. Maybe it's all private rooms. Maybe there's a different decor that's used in that space that's more appropriate for that population. Maybe the staff receives additional training, or maybe that's where you assign that specialist that we were talking about earlier to kind of help out and work with the residents. So here I would think about, do you currently have a specialized area in the facility? And do you think that, if you don't, do you think that it would be beneficial to develop an area where you can really focus? If you have a large enough amount of residents that have specialized needs, would it be beneficial to develop an area? Is there a particular area in your facility that would be well suited for their needs? And finally, our last item in step 2 is partnerships with community agencies. And so I know that you're probably very familiar with the continuum of care on the physical health side, right? We have the hospitals, we have nursing homes, we have home care. We may have lots of other levels in between, like rehab hospitals now, or maybe even thinking about assisted living facilities, right? We know what our continuum of care is, where patients go up and down through that continuum of care as their care needs change. What you may not be so familiar with, because it's just not your background working in a nursing home, is that on the behavioral health side, there's a very similar continuum of care. There are outpatient mental health clinics, there are inpatient treatment providers for mental health, inpatient treatment providers for substance use, medication-assisted treatment clinics, right? Clinics that provide medication for folks who have opioid use disorder. Then there are much more lower levels of care, like just Alcoholics Anonymous groups, right? AA or Narcotics Anonymous, NA groups, or psychosocial clubhouses, which is a space for folks with serious mental illness to get some socialization. So there's a similar continuum of care here. And many of these types of agencies are probably right there in your community. They might be down the block, they might be just a little bit away from you. And there may be an opportunity to partner with them to meet the needs of your residents. Whether that means actually transferring a resident between your facility and their facility when it's appropriate, or whether that means having their staff come into the facility and provide support in a consultation kind of capacity, there could be opportunities for you to collaborate. And so I encourage you to think about, what relationships do you currently have in place? You might have a relationship already with a psychiatric hospital in your community. And I'll say it might be for better or worse, right? Sometimes those relationships are challenging because the psychiatric hospitals are looking to transition patients out of their care that are intended to be there for a short-term period. And sometimes the nursing homes feel, well, I don't feel this person is ready, or I don't feel I can meet their needs. So there's kind of a little bit of a give and take sometimes between those parties. And so that relationship can be tricky. But think about that. Do you have a good relationship? Is there something that you can do to strengthen that relationship? Like I was just describing, maybe sharing a provider. Sometimes I've had the experience of sharing a psychiatrist between the hospital and the nursing home, meaning the same psychiatrist that sees the patients in the psychiatric hospital is coming to the nursing home and acting as the psychiatrist for those patients in the nursing home, which provides you with a certain element of trust, right? We have this psychiatrist who's a kind of a source of truth for us, who's telling both parties this is what's actually happening with the resident. So are there ways that you can improve that relationship or develop a new relationship with one of these other types of providers? Very often they may be interested, and just like you're not so familiar with them, they may not be so familiar with you as a nursing home and what your capacity is and what you can do. So I encourage you to think about that, what relationships currently exist, what might be beneficial for you based on the needs of the residents in your facility. And so we've made it through step 1, where we looked at all of the characteristics of our residents. Step 2, where we looked at all of the capacity that we have in our facility. What are our strengths? What do we currently have in place as it relates to behavioral health? And now we're up to steps 3 and 4. And like I mentioned at the beginning, we're not going to delve into steps 3 and 4, even though that's where most of the work happens. That's the most challenging part. So now we're going to take, in step 3, we're going to take everything that we've learned about our resident population from step 1, everything we've learned about our facility capacity from step 2, and we're going to do a comparison and look for any gaps. Are there any areas where we have needs that the residents have, but we're not currently meeting them? Or even if we are currently meeting them, we feel we can strengthen what we're doing for the residents in this area. We can proactively plan for how to meet their needs. We know they have these needs. We know our current offerings are, not as good as they can be, and we want to improve them. And we're going to identify all those gaps. And then in step 4, we're going to develop and implement a plan. So we're going to say, okay, now that we've identified those gaps, here's a list of the areas that we want to focus on. We're going to have, what I would recommend doing is have a brainstorming session, right? If you haven't brought in the entire leadership team, like all department managers. At this point, definitely, you might want to do it in step 3, but definitely by step 4, you're going to want to have the whole team together to kind of brainstorm what ideas they have for how to bridge those gaps. What can we put in place? What do we need from our team? What kind of training do we need to offer to our team? What partnership can we develop in the community, or should we check out? Or what kind of additional behavioral health specialized staff would be beneficial for us? And how can we go about doing that for our facility, right? Every facility is unique and has unique needs. What will make sense for us? And so, like I say, that's the hard work, right? That's the hard work where you're actually implementing a change. But hopefully, as you're going through that process, you're able to identify some areas that you can work on. And our center offers a lot of support in that area too. So if you identify a particular gap and you're doing the brainstorming part and you're struggling, right? You're up to step 4 and you're saying, I don't really know what I can do to address this. I encourage you to reach out to us. We have a team of behavioral specialists. They're behavioral health experts, and we have 10 of them spread throughout the country in different regions. And so they're in your region. We'll connect you with them. You can go to our website and click submit request, send them a quick request. They'll get back in touch with you within a day or 2 and set up some time to talk about it. And we may have some really good suggestions for you. We have a good team of experts that have a lot of knowledge, but then we also continue to learn from all of you, right? As we're interacting with you, you're giving us a lot of ideas from all over the country, and we're able to share that and to maybe make a suggestion that will work for your facility. So I encourage you to, take advantage of that, if you think that could be helpful for you. And so with that, I hope that this was helpful and gave you some practical tips. And I think we have a few minutes to do a little Q&A. If anyone has any questions, feel free to share them, Nikki and Michelle.
Thank you, Jay. At this moment, we're getting thank yous, and this is very helpful, but no questions. Okay, Michelle, we'll check in with you. Do we have any hands raised?
We do not have any hands raised at this time. If you do have a question, you can click the raise hand icon at the bottom of your screen. And if you'd like to ask the question, I will unmute you and you can ask.
Thank you.
All right, so we'll give everyone a moment to think about whether there's a question you want to ask. It is a big group on the call. If you're more comfortable sending a question to me, you're welcome to do that after the session. I really enjoy hearing from participants from the session, kind of hearing, what was helpful for you, or answering any questions you have, if I can help out or share anything with you. And I also just wanted to mention that these slides will be available to you on our website. So if you're looking for some of those specific MDS items that I referenced in the step 1 of our presentation, kind of where to find things, you can go back to that slide and find the exact item. If you're looking for A1500 to capture those PASSRs, you can go in there and it'll be available to you. It should be, I think it might be up on the site now, or if not, it'll be available very soon on the website.
Thank you so much, Jacob. We actually have placed the slide link in the chat box for your convenience. We do have a question. Are there examples of assessments that help ensure clear compliance?
I think that's, it's a really good question. I know that there's a facility assessment tool that's available on the QuinnQIO website. That's the Quality Improvement Organization website, which you might be familiar with your particular quality improvement organization in your region. There's about a dozen of them throughout the country, and they're CMS created, and they're there to support facilities. And I know they have a tool that they share on their website that includes kind of follows along with the regulations, but even on their tool, they note that the tool is just kind of a starting point, and you really do need to mold it to your facility to meeting the needs of your facility. And I was mentioning kind of at the beginning of the presentation, that tool follows closely some of the CMS guidance and captures that CMS form 672 with behavioral healthcare needs. But again, that's kind of talking more about Section E and behaviors, and that's what the CMS form focuses on. And so it kind of logically flows to include that in your facility assessment, but it may not tell the full story, right? It may not give you a full picture.
Thank you, Jay. We also have some additional things in the chat box. Let's see. Do you have any specific recommendations for assessments for residents?
That's a great question. So I think, there are kind of different areas of assessment. So I'm thinking you mean like how to assess residents for a particular area to identify whether they have a behavioral health need. And there are different assessments for different things, right? We know for depression, for example, Section D in the MDS has an assessment right in there that we're already completing, PHQ 9, right? Just converting over, it's changing a little bit in October, but it'll be there for you. For trauma history, for substance use disorders, for maybe suicide prevention, there are some good tools out there that you can use. And I think we even offer some sessions on that, and we have some good resources for that on our website. I couldn't go through all of those with you right now. It's like a whole nother topic that we could spend quite a bit of time on. But there are some good simple tools that you can use for each of those areas that you can either incorporate into a social service assessment or a nursing assessment, or you can add it as its own, like a little assessment item within your electronic medical record for each of those areas. Sorry that I can't go into the details, but it really is, that's a big topic that we could spend a lot of time on together.
Thank you so much, Jay. We have some additional questions, but to add to what you just said, for the person who asked that question, please visit our website and put in a request. And one of our regional behavioral specialists who covers your region can follow up with you. And at that time, we can get more specifics to you around those screening tools. Jay, we have a question here. Do you do any trainings with outside agencies? We work with facilities and advocate for residents, and we are seeing more and more behavioral health issues. So this would be a good training for them to see.
Yeah, that's a great question. We do provide training to certain stakeholders that work directly with nursing homes. We're really focused, though, on supporting the nursing home staff. Encourage whoever's asking that question to, you can, send me an email directly, and we can review, what exactly your request is and see if it's something that we can support.
And we also will have the recording of this training on our website in 7 to 10 business days. And you are more than happy to download that and share that with your group. Jay, we have a question. What is the name of that assessment with QIO organization?
I don't think it has a name. I hope I'm not getting this wrong, and one of my QIO friends will tell me about it. But I believe it's just called Facility Assessment Tool. If you go to, there is a website for the kind of like a national clearinghouse for the QIO. And so if you go there, I believe, I'm sorry, I don't have the link in front of me, but if you type in QIO program, you should come up with that on Google. And then once you get to their website, you can type in Facility Assessment Tool into their search, and I'm sure it'll come up, but I don't believe it has a special name. I think it's just Facility Assessment Tool.